Hello everyone and welcome to my channel. My name is Ramela and I learn best when I teach, and I'm sure a lot of you have problems in a lot of topics. I am a good teacher, so I can help you with your study process and you'll have a study partner. It's going to be more like you learning from a friend than you learning from a teacher. During this process, I will be recording videos on my iPad and I will try to make it as appealing as I can. And I will be starting with cardiology. So, valvular heart disease is going to be my first topic. And before I dive into the actual valvular heart diseases, I want to discuss the anatomy behind the valves of the heart and how they work and how cardiac cycle works and what is S1, what is S2, and all of that, so that you have an overview of the entire thing so that you can understand better when we discuss the actual topics. And I will be helping you with solving exam questions because I am in the process of doing that myself. So I will be helping you solve questions from UWorld, and that will better equip you to take the exams for USMLE and MCCQE1. Let's dive right into it and talk about the anatomy of the heart. This is the standard diagram of a heart, and as you would know that the heart has four chambers: right atrium, right ventricle, left ventricle. And the valves are mitral valve between the left atrium and the left ventricle, and then the tricuspid valve, which is between the right atrium and the right ventricle. And then we also have two more valves, which are aortic valve and pulmonary valve. The aortic valve is basically the valve to the aorta. So the aorta is supposed to propel the blood from the ventricles to the rest of the body, and this is going to be oxygenated blood that comes back from the lungs to the left atrium and then the left ventricle and then to the rest of the body. And then we have the pulmonary valve, which basically gets blood from the right atrium, and then the atrium would push the blood through the tricuspid valve into the right ventricle, and then the blood will go to the lungs through the pulmonary artery to get oxygenated, and the process would repeat itself. Now that we've discussed this, and now that we know the locations of the different valves, let's look at the valves themselves. We have four basic valves in the heart, and three of which are tricuspid. So the tricuspid valve, the aortic valve, and the pulmonary valve. All of these are tricuspid valves because they have three cusps. And there's only one valve, which is the mitral valve, which is between the left atrium and the left ventricle, which is going to be a bicuspid valve. The aortic valve and the pulmonary valve are also known as semilunar valve because if you look at them, they look like they have formed half a moon. So that's why they're called semilunar valves. I also want to discuss a few other things. For example, what is S1 and what is S2? You know how like our heart makes sounds, lub and dub? And if you put a stethoscope on the heart, you will hear sounds like lub dub lub dub lub dub lub dub. So those lub and dub sounds are called S1 and S2. And the S1 sound is the sound of the mitral valve and the tricuspid valve. So this valve and this valve closing. So that's the sound it will make, and it's going to be called lub or S1. And then the dub sound is basically the S2, and that is when the aortic and the pulmonary valve close. And between these two sounds, there's going to be systole and diastole. So between S1 and S2, when mitral valve and tricuspid valve close, when aortic and pulmonary valve close, between these two, there's going to be the systolic phase. Between the S2 and the mitral and the tricuspid valves will close, this is going to be called the diastolic phase of the cardiac cycle. After all of that discussion, I lightly want to touch upon the cardiac cycle. I like to start my cardiac cycle from atrial contraction, because this is going to signify atrial systole. Atrial systole is basically when your atria is actively contracting and pushing blood into the ventricle. After the SA node fires, it will depolarize the atria, and the atria will actively start contracting, pushing the blood into the ventricles. And this will signify the P wave on the ECG. So you know how ECG looks something like this? So this P wave is basically the atria contracting. So if there's something wrong with the P wave, just know that there's something wrong with the atrial contraction. At this point, the AV valves are open and the blood is going directly into the ventricle. And this phase will be known as atrial systole phase. After the atrial systole, when the blood has rushed into the ventricles, these valves will close. So when these valves close, we know that the loop sound is because of the closure of mitral valve and tricuspid valve. So after the closure of mitral and tricuspid valve, we will get our first heart sound, which is going to be the lub or S1 sound. And that is when all of the blood from the atria has gone into the ventricle, and the ventricle is now contracting without the opening of the aortic and pulmonary valve. And this is going to embark the next phase of the ventricular systole. The ventricular systole is basically divided into two phases. The first phase is going to be the isovolumetric contraction, and at this point, all the valves are closed. So at this point, the ventricle will be contracting, but it will be contracting in its own place without propelling any blood, and it is going to be called isovolumetric contraction. And at this point, the pressure will be increasing in the ventricle, and this is going to embark the first phase of ventricular systole. And if you look at the ECG, at ECG it will be shown by the QRS complex. So if there's anything wrong with the QRS complex, know that there's something wrong with the ventricular systolic, isovolumetric, and ejection phase, and there's something wrong with the ventricle propelling blood forward. After that, when ventricles have enough blood and they have contracted and produced enough pressure, what's going to happen is that the aorta and the pulmonary valve are going to open. After the aorta and the pulmonary valves open, the blood is going to be propelled forward from the ventricle into the aorta, into the rest of the body, from the right ventricle to the pulmonary to the lungs, and that is going to be deoxygenated blood, which is going to the lungs to get oxygenated. And this is going to be the rapid ejection phase, or ventricular systole phase 2. And this is when the ventricle will be ejecting all of the blood from the ventricle into the body and the lungs. And at this point, the ventricular pressure is going to be more than the pressure of the aorta and the pulmonary artery. That's why these will snap open and the blood can be propelled forward. After ventricular systole, we'll come back to ventricular diastole. Ventricular diastole is the phase when the ventricle is actively relaxing. After the ventricle has ejected all of the blood from itself into the system, the aorta and the pulmonary valve are going to close. And like we had discussed, lub and dub sounds, lub sound was S1 and dub sound was S2, and it was because of the closure of the aortic and the pulmonary valve. And at this point, the dub sound or the S2 sound will be heard, and now is the point where the ventricle is going to relax. And if you look at ECG, this relaxation will be embarked by the T wave, which is going to be ventricular repolarization. After this phase, what's going to happen is, again, the process is going to repeat. The atria is going to fill up with blood. The atrial pressure is going to be more than the ventricular pressure, because of which this will snap open. And after the atrioventricular valves snap open, blood is going to fill into the ventricles, and this is going to be called ventricular diastole later phase. And at this point, the atrial pressure is going to be more than the ventricular pressure, and the AV valves will open and passive filling will happen. I want you to remember one thing: when I say it snaps open, it does not produce any sound. So the S1 or S2 is not the opening, but the closing of valves. Let's move on to the first step of the process, which is going to repeat in the cycle again. And the cycle is going to go in circles and circles and circles, and it's going to be a never-ending process until you obviously die. This is going to be your cardiac cycle. Now that we've cleared that up, I want to move on to valvular heart diseases. Like we had discussed earlier, we have 4 valves, so tricuspid, bicuspid, aortic, and pulmonary valve. But when we discuss the topics, we are going to concentrate more on aortic valve and bicuspid valve. These are going to be the valves that are going to be most pathologically affected. So when we talk about aortic valve and mitral valve, we have to keep in mind 4 kinds of diseases. So the types of valvular heart diseases that we will be discussing in the future videos are going to be aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation. I want you to remember this mnemonic that I've come up with, which is going to be Mr. Ass and Miss R. So Mr. Ass is basically going to be a systolic murmur, it's going to have systolic murmurs, and then Miss R is going to have diastolic murmurs. So I want you to remember that, because in questions they test you a lot when it comes to systolic murmurs and diastolic murmurs, so it will narrow down your options for you. So Mr. S is basically mitral regurgitation and aortic stenosis. Both of these conditions will have systolic murmur. It can be pansystolic murmur, hollow systolic murmur, blah blah blah. So basically it means it's going to be between S1 and S2. And then your Miss R is going to be diastolic murmur, which means that mitral stenosis, aortic regurgitation, all of these are going to happen between S2 and S1. So after the closure of aortic and pulmonary valve to the closure of mitral and tricuspid valve, in between these two you're going to get your diastolic murmurs, which are significant for mitral stenosis and aortic regurgitation. And these you need to remember, because in questions they will test you saying that this person came with this disease, this is symptoms, blah blah blah, and this person had diastolic murmur or systolic murmur. Which of the following options is correct? So that will narrow down your options for you. This was kind of an overview for your valvular heart diseases. I am going to go into depth, and I will be teaching you from first aid step to CK book in the next video. I'll be starting with aortic stenosis, and at the end of the lecture I will also be solving one or two questions from UWorld with you guys, just so that we can understand what kinds of questions will be and what kinds of things we need to remember when it comes to exam questions and exam materials. So I'll meet you in the next video. Thank you so much for watching. If you made it till the end of the video, I will see you in the next video, which is going to be about aortic stenosis. Till then, take care of yourself. Bye.